Membership fees apply after free trial. Cancel anytime.
Can I be real with you for a second? That goal you have to exercise and eat better, you really can do it, but nobody is going to do it for you. Nobody is going to push you out of bed to work out. Nobody is going to make you eat better. But here's the thing, nobody has to, because you can do it if you have the right tools and a community that cares about helping you get results. And that's us, Beachbody. 2.5 million people, each doing the Beachbody program that fits our own goals. Over 80 to choose from, some that take just 20 minutes a day. Nutrition plans that teach you how to eat healthy and still enjoy food. What we all have in common is we know it's not easy, so we help each other. It's as convenient as your TV or laptop, but you need to decide that you're worth it. That's why I'm inviting you to try our amazing Beachbody fitness and nutrition programs. Let us help you succeed. Here's how. Go to beachbody.com to claim your free membership and start feeling great.
It is seen anyone has to ask a question to a doctor. 8 out of 10 times it is not concerning a prescription, but a doubt one may have in his or her own mind about a health issue or something you heard. Well, for all such doubts, all such queries, we are here at Dr. Saab, Hindi on Wednesdays and English on Fridays. Do subscribe and share our podcast to your contacts and friends. After our previous podcast on diabetes, we have got a lot of questions from our listeners. So today I am addressing such questions which I am sure will be in the mind of every diabetic or every person having a diabetic in the family. So the first question goes is, what is diabetes mellitus? Diabetes is a disease where a hormone in our body called insulin is either produced less or is defective. It is not as effective as it should. What does this insulin do? This insulin allows the glucose in our bloodstream to be taken up by tissues and cells and used as energy. So if this insulin is either insufficient or ineffective, then this glucose remains in blood, does not reach the cells, leading to two major effects. One, the blood sugar level goes up, and secondly, because the tissues and cells don't get energy, the patient feels fatigue, the patient feels unwell. I hope in the simple language this is enough to understand what is diabetes mellitus. Then somebody asked, what should my blood sugar be? So I am presuming the gentleman who asked, he is a known diabetic. So I will say, whether on treatment or not on treatment, your fasting blood sugar should be between 100 to 110, and your post-lunch blood sugar should be between 140 to 160. Lower the better. If you are 99, so much the good fasting, or if you are 120 post-lunch, very good, but do not allow it to drop further, as you may get symptoms of hypoglycemia. Please do not do random sugar ever, because that does not help your doctor treat you or modify your treatment. Secondly, I would give a word of caution here. A post-lunch sample is a true post-lunch sample. At times the labs tell you, after they collect the fasting sample, go home, have a heavy breakfast and come in 2 hours. No, that is the wrong way. The treatment that you are taking has been given in such a way that when you have your lunch around 1:30, that time the sugar is high and the tablet will work at that time. So have your lunch at the usual time and do a blood sugar level 2 hours after that. That is your post-lunch blood sugar. Then Mr. Ram Saran from Bihar has asked, Sir, ye, what is HbA1c test or A1c test? Very smart question, Mr. Ram Saran. What used to happen is patients will consume all sweets, all wrong foods, and 4 days before they had to go for a blood test, they would control everything and come up with a normal report, misguiding the doctors. So, this HbA1c gives an average of previous 90 days blood sugar. It tells you over a period of last 3 months or 90 days what was the average blood sugar. This way the doctor gets a fair idea whether your blood sugar is coming under control properly or not. Ideally, HbA1c in a patient on treatment should be between 6.5 to 7. Then Imtiaz Bhai has asked from Bombay, what does it matter if my blood sugar is 120 or 250? My sugar is always 240 and I never feel anything. So, how does it matter that I have to bring it down? Very good question. Diabetes is known as one of the silent killers. You all must have heard of cases where the patient was fine the previous night and just did not get up this morning. So, even when all blood sugars are normal, the very fact that the person is a diabetic is causing some problem in the body of the patient. And these problems occur in brain causing a stroke, eyes causing retinal damage and irreversible blindness, heart causing heart attack or heart failure, and kidneys causing chronic kidney disease or kidney failure leading to dialysis. Nowadays, we are getting lot of youngsters with diabetes. So this should worry you. Diabetes can also lead to impotency or erectile dysfunction. Then it leads to death of nerves called neuropathy. And if you're also a smoker, there's a higher chance that you will end up with a gangrene and maybe one or two toes may have to be cut. So, yes, it matters a lot what your blood sugar should be because you will not feel anything even if it is 500. So, then another question which we had asked last time also, that means I cannot eat what my family members eat and I can't afford to cook separately for me. You are wrong. You can eat what your family members eat, but you have to think of the portions. You can have 2 tablespoons of cooked rice each meal. You cannot have a mountain of rice in any meal. Avoid sweets, cut down on oil, eat what your family eats, but portions are important. You cannot have 4 chapatis for breakfast, 6 for lunch, 6 for dinner. No. Breakfast should be no chapatis, whether it is wheat or bajra or jawar or nachni. Lunch should be one, dinner should be one, and you have to fill yourself with lot of salads, lot of vegetables, lot of pulses. So you need not cook separately for yourself. You can eat what your family wants. Then I have been told, Asha ji is asking, I have been told that I have to avoid carbohydrates. Is it true? And what foods have carbohydrates? Yes, Asha ji, if you avoid sugar, jaggery, honey, all three, all foods have carbohydrates and carbohydrates ultimately convert to sugar. So what you have to be careful about is starchy vegetables, potato, sweet potato, tapioca, cereals, wheat, jowar, bajra, nachni, rice, white bread. All grains have carbs, pulses have less carbs. Then snack foods like chips, popcorn, they have good amount of carbs and they may have a lot of fats also. Normally people don't count when they say sweets, they don't consider soda, cakes, candy, chocolates. They just say I'm taking only one. They also contain carbohydrates. Fruits have carbohydrates, so that's why we say fruit also in moderation. Fruit should not be taken with meals, should be taken 2 hours before or after a meal. So this way you have to be careful, and if you're buying anything packed food, then you have to read the nutrition label. Learn to read the nutrition label, and you will be shocked on hidden sugar in each of the packaged item. Then Sunita ji is asking, suppose it is sugar free. Can I eat as much as I want? No, I already said portions are important because everything contains carbohydrate. You can't have unlimited quantity of anything. What is good in moderation. So if you're advised almonds by a doctor, that is 5 almonds. If you're advised walnut, that is 1 to 2 walnuts. You cannot eat unlimited quantity of anything. Best is if you're finding it a challenge to control your diabetes, approach a dietitian in addition to your doctor and get tips. And then Priyanka is asking, can diabetes be cured? No. Sadly, diabetes cannot be cured. It can only be controlled. By the time a person has diabetes manifested in blood sugar reports, it's already been 5 to 10 years that the problems are happening in the system. The pancreas cannot be made to produce more of insulin. You can control it by a judicious combination of diet control, regular effective exercise, and drugs if needed as advised by your doctor. That is all for today, friends. Till next week again. Bye from Dr. Saab. Please share our podcast, like it, and subscribe to the feed. Thank you very much.
Membership fees apply after free trial. Cancel anytime.
Can I be real with you for a second? That goal you have to exercise and eat better, you really can do it, but nobody is going to do it for you. Nobody is going to push you out of bed to work out. Nobody is going to make you eat better. But here's the thing, nobody has to, because you can do it if you have the right tools and a community that cares about helping you get results. And that's us, Beachbody. 2.5 million people, each doing the Beachbody program that fits our own goals. Over 80 to choose from, some that take just 20 minutes a day. Nutrition plans that teach you how to eat healthy and still enjoy food. What we all have in common is we know it's not easy, so we help each other. It's as convenient as your TV or laptop, but you need to decide that you're worth it. That's why I'm inviting you to try our amazing Beachbody fitness and nutrition programs. Let us help you succeed. Here's how. Go to beachbody.com to claim your free membership and start feeling great.